right now we're going to talk about what to do if someone's choking. So when someone is choking, the best way for that foreign body to get out of the patient's throat is for him to cough it out. So most commonly it's going to be a piece of food or something like that, or a candy. So we want to help the patient cough that out if needed. So in order to do that, we will just encourage him and support him to cough, okay? But if there's signs of severe airway obstruction, then we have to intervene. So normally, when someone has severe airway obstruction, they will be doing the universal choking sign. So this is a reflex of what people will do wherever they're from, whatever their culture, if they're choking. Okay. So what are some signs of severe airway obstruction? If there's a silent cough, meaning they're trying to cough but there's no sound coming out, or if they're trying to talk and they can't make the sounds, that's a sign of severe airway obstruction. Also, if they seem to be turning blue or getting drowsy, then we have to intervene. Okay. So if they're doing the universal choking sign, we can approach, and of course first I have to confirm, are you choking? So if he confirms that he's choking, then I can intervene. Okay, so I'll tell him first, okay, I'm going to help you, because we have to help calm them down. Okay, so I'll approach the patient from behind, okay, and then I will put my hip up against the back of his hip this way for stability. Okay, so I'm supporting his weight. Okay, I'll wrap my arms around, and I will put the this part of my thumb, the sharp part here, up against his belly. Okay, it's going to have to be midway between the belly button and the bottom of the breastbone. So if you measure the belly button to the bottom of the breastbone, in the middle of that is the soft part of the stomach, the rounded part of the stomach. Okay, so I'm going to put my thumb into that rounded part of the stomach. I'm going to take my other hand and wrap it around the fist right here. Okay, now this is what's commonly known as the Heimlich maneuver. The goal of the Heimlich maneuver is to generate a small amount of force to dislodge any foreign bodies and allow the patient to cough it out. Okay, so in this position, I'm going to grasp my fist, and then I'm going to be doing 5 upward and backward thrusts. Okay, up against my hip here. Okay, so I'll do 5, 1, 2, 3, 4, 5. Of course, in reality, it will have to be a lot more forceful than that. Okay, and the goal here is to dislodge the foreign body so that the patient can actually cough the foreign body out. Okay, so if after 5 thrusts it doesn't work and the patient still has severe airway obstruction, I'll continue to do another 5 thrusts. If the patient is able to cough the foreign body out, then I can just support and allow him to sit and rest, and he should be able to breathe already freely. If the patient becomes unresponsive, which means he becomes unconscious during this process, I can no longer do a Heimlich maneuver. If we do the Heimlich maneuver, we dislodge the foreign body, and if the patient is unconscious, he can no longer protect his airway, and we may dislodge the foreign body, and it may fall deeper into his airway. So Heimlich maneuver is not indicated for unconscious victims. Okay, so the Heimlich maneuver can also actually be done from someone in a seated position. So if, let's say, he's sitting down and having lunch, for example, and he's choking at that point, I don't have to stand him up. I can just do the same thing, approach from behind, and do the Heimlich maneuver this way. Okay, so if we're, again, if the patient becomes unresponsive, well, I have to put him down on the floor, and then we have to do CPR. Okay, so from that point, the patient becomes unresponsive. I'm able to support his weight this way, and then I lower him slowly down to the ground. Supporting his head, and at this point I'll do CPR. So anyone who's had a Heimlich maneuver or abdominal thrust needs to be examined by a health professional after to check for abdominal injuries. So it's possible that they have abdominal injuries, but remember, it's still more important that we did these thrusts to help relieve the airway obstruction and save their life. If we don't intervene, then they may be dead within a matter of minutes.